Welcome to Graceful Healing, a podcast to get straight talk about healing and living again. My name is Maureen Lake. I'm a holistic health coach, speaker, author, and thyroid disease fighter. Each week, I'll be bringing you graceful conversations to inspire you to seek new ways to hit the reset button to catapult your health and vitality to new levels. Listen in and open your heart to all the new possibilities. Are you ready? Let's do this. I first met Lisa Paladino when we both attended Dr. Aviva Romm's program, the Women's Integrative Medicine Institute. It was during this time that I had the very good fortune of interviewing Lisa for my book, all about thyroid disorder. Lisa's an expert on many topics, including thyroid, lactation, women's wellness in general, and currently she's working with many women who have PCOS. And interesting, it's women of all ages, from teens to menopausal. Listen as Lisa digs deep into the root cause of PCOS and explains in real common language how best to address this disease. Please join me as I welcome Lisa. Hello, everybody. I'm so happy to have Lisa on the show today. I met her when we took a program together with the Dr. Aviva Romm, and she has been such an inspiration because of her knowledge about thyroid disorder, and I can't wait for you to hear about her new knowledge that she's going to share today and the journey that she's come on with us. So, hi, Lisa. How are you?
Hi, Maureen. I'm fine, and I'm very happy to be here with you today. Thank you for having me.
Thank you for being here. I'm so excited. So, Lisa, can you share a little bit about your personal story and really like the journey about how you landed where you are today? And anything else you want to share about your background and your own medical history and how it's helped you move forward?
Sure, yeah. So basically, I grew up, I like to say, very unenlightened. I ate the standard American diet. I was not healthy, but I didn't realize I wasn't healthy. Mm-hmm. Went to nursing school, became a total medical model. And then at a certain point, I realized, or I felt that I wasn't doing my patients justice because I wasn't really, there was something missing and I didn't see enough real change except for medication. So I felt like all that we were doing for people was medicating them. Even, I worked as a labor and delivery nurse, and birth wasn't what I imagined it should be, witnessing birth in the hospital. So I started to educate myself, and I read a lot, read so many books. I don't know if you've ever heard of the book Spiritual Midwifery by Ina May Gaskin. She inspires a lot of people's journeys. And I started looking at there's another way to do this. And gradually I went back to school, got my bachelor's degree as my kids were young, and then went back and got my master's in midwifery. I practiced as a midwife in the hospital for about 10 years.
Oh, wow.
Full scope. Yeah. 24/7, 365, 364, I like to say. I took one day off. I promised patients I'd be with them, except Christmas Eve, because that's a very special day for my family. So imagine having, a family and going back, going to school, and that involved an internship, being on call, and then moving into having my own practice and my own patients. So I went until I couldn't anymore. I started not doing well. I started gaining weight. I started realizing that things weren't, I finally started looking at my own health. Let's put it that way. And I realized that my thyroid, I literally burned out my thyroid. There was a lot of emotional stress there too, a lot of suppression of my voice at the hospital, because as I learned more and more about what should be for patients, but that didn't fit in with the model there. So it was a little bit of a...
Oh, that's got to be hard.
Yeah. So I started, I didn't want just to go to the doctor down the street and get thyroid medicine. I wanted to know about it. So I started researching and learning. And in the meantime, as you mentioned, Dr. Aviva, I took her herbal medicine course. I just came across it one day.
Oh, you did?
Yeah, that's where I started with her.
Oh, okay.
And that was really eye-opening because it was like a paradigm shift in my brain, not just about what other options there were for health, And I started down a journey of changing my own diet. My husband and I decided together we didn't want to be old and sick like we saw our parents and our relatives and even people of our own ages. Right now I'm 54. This was probably about 6 or 8 years ago. And, we were saying we're approaching 50. We don't want to be old and sick.
Mm-hmm.
So what do we do about it? And so we changed our diet. We cleaned up our diet. We took out as much of the toxins that we can in our world and ate more vegetables and all the things that,
Mm-hmm.
for sure, what leads to a healthier life. And I'm definitely, feeling better. But what happened more than anything was my mind opened up and I became more clear. And I realized that I wasn't stuck where I thought I was.
That's huge.
Aviva really helped that. She really empowered me to say, if you're not happy there, why are you staying there? Because we know that health is much more than just what we eat and what supplements we take, right? So emotionally, I was being suffocated. So I said, I have to get out of here. So it's going to be 4 years actually this month. I left the hospital job and I opened up a private practice in women's health. And in the middle of all that I was doing more research into breastfeeding and learning about breastfeeding. So I became a lactation consultant. And so my practice is lactation and women's wellness. And that's basically how I got to where I actually am. How I got to my focus on PCOS is do you want me to talk about that now too?
Absolutely. Yeah. I think it's fascinating because it's similar, but not,
Exactly. So all aspects of women's wellness. I run 5-day detoxes online. I have women coming to me of all ages coming to me for their annual GYN exams or a little bit of nutritional support, thyroid support. And then all of a sudden I had a run of women who were in different stages of life, all having PCOS. A couple of them were very young. One of my cousin's daughters, 15 years old, total, irregular periods. And she wouldn't, I'm not identifying her. I'm just saying this is a 15-year-old girl, apparently healthy, active, an athlete, bleeding almost every 2 weeks with her period.
Oh, wow.
And testosterone levels off the charts. So in the same week I had an ongoing patient who came to me with a history of PCOS who was trying to get pregnant. And then who did get pregnant, by the way. And then I had 3 people who were having trouble with breast milk production who had a history of PCOS. So because all of this hit at the same time where I was trying to figure out where to put my next focus, I did a deep dive and lots of research. And along with what we learned in Dr. Aviva's course, with some additional research, and then I started doing like a beta test on a course for PCOS, women with PCOS, and I interviewed a lot of women with PCOS, and I put together a program which I'm starting to offer as we speak, focusing on PCOS. And what I like to say is if you get PCOS under control, the absolute result could be pregnancy. But that's not the only reason to get PCOS under control. So I just gave a talk this weekend. It was getting pregnant or not. So one thing we don't think about is women that have hormonal disruption and irregular periods have just as much trouble preventing pregnancy as they do getting pregnant.
Oh.
Because they have no idea when they're ovulating.
Yeah, that makes perfect sense.
Right.
Yeah.
And in the mainstream medical model, what do? We give birth control pills for irregular periods, sometimes up to 15 or 20 years, which I've seen in my practice. Women have come to me after being on birth control for that long. Then they come off the pill and they have no cycles and they don't know, or they bleed almost continuously. So they don't know when they're ovulating, if they're ovulating. So they don't know even how to plan their families. They can't use natural family planning. It's just everything is out of control. They don't know when they can go on a vacation and enjoy themselves, with irregular cycles. So it's about getting pregnant. It is about fertility, but it's just as much about a woman having hormonal balance that keeps her whole life in her control and awareness.
My daughter went to the doctor and they told her that she had, I don't know how many different symptoms, categories there is to PCOS, but she didn't have all of them. She had a lot of them. So they treated her as if she did, and with supplements and some different things. And they took her off of birth control because she was, like you said, she was on it only because to try to regulate her cycle. But whatever protocol she followed, it really worked. And her testosterone came down and everything just kind of balanced out. Now, whether she was 100% PCOS, I honestly have no idea. But even so, it made such a tremendous difference in her lifestyle. And she has no intention to get pregnant anytime soon or anything like that. But it helped just regulate her life. Just the emotional up and downs and just unbelievable difference in following just like a holistic type of protocol. It's incredible.
So she's very lucky to have found somebody for her, because it's really hard sometimes to find the right provider that's going to look at things holistically.
I know. Isn't that the truth?
Yeah.
Gosh.
So what's really, I don't like to get down the scary rabbit hole, but I think it's important to mention is that PCOS isn't just about hormones. PCOS, because there's high androgens, meaning high testosterone or male hormones in a woman, that leads to metabolic syndrome, whole syndrome of heart disease, risk of stroke, diabetes, and, cardiovascular events. So if we just if we don't treat the underlying symptoms and get to the root causes of the PCOS, just cover it up with regulating the period with a pill. And this goes on for years. Now you have a 40-year-old woman with high blood pressure, diabetes. She's overweight, and it's gone so way beyond the hormones.
Right.
Cycle. And so insulin resistance, we should talk about, is the beginning, or the first step that your body goes through when you're trending towards type 2 diabetes. And it's growing in our country.
Oh, boy.
And we know that.
Yeah.
And my suspicion is that part of the reason that we're seeing so much of that is because women 20 years ago who were showing signs of PCOS, instead of us looking at the underlying causes and fixing it, we covered it up, and now they're in full-blown metabolic syndrome, diabetes. So it's important now, I think, for young women to realize and to take control of things to prevent future chronic disease.
Oh, absolutely. So what are some of the root causes that you have found?
So basically, it's really interesting because no matter what phase of women's health care concerns I study, the root causes are basically the same, just a little bit more weight in some than the others. So we look at gut health, right? So one of the coolest facts that I've learned is that our estrogen balance is regulated by our gut bacteria. Isn't that cool?
That is amazing. God.
Yeah. So it's up to those little buggers to let us know how much estrogen should be there. So that's really cool to me. So if we have dysbiosis, meaning some of the gut bacteria that is less desirable is higher than the desirable gut bacteria, that can cause all kinds of problems. Most of us have leaky gut, which leads to inflammation if we're eating inflammatory foods. So that's a big other part of gut health, because once you have inflammation, then everything else goes out of control as far as insulin resistance and hormones. The other big root cause is environmental, or the toxins that we're exposed to and how well our own detoxification systems are working. Right. So if we know in our world, we can't help but be exposed to more and more chemicals, pesticides, plastics, things that act as endocrine disruptors or mimic or block the actual hormones in our body. So we're exposed to lots of that, and some of us more than others. And if the organs of detoxification aren't working efficiently, then that builds up in our bodies, and our own hormones are blocked. So the organs of detoxification, the skin, the liver, the kidneys, the lymphatic system, and then also back to the gut. If we're not having healthy bowel movements to eliminate everything that the liver filtered for us, that all gets reabsorbed again, and now your liver's got more work to do.
Yeah.
So avoiding toxins when possible.
I have to tell you just this one little snippet. For Lent this year, because every year I try to give up something for Lent, right? And it's usually like, right, I don't know, hot tamales or chocolate or something like that. And this year I decided to give up plastic.
Wow.
I couldn't do it.
Hard.
There's no way. Yeah. And I just figured, if I could give plastic up, that would not only help my thyroid, but help just every other kind of toxin entering into my system. But I couldn't do it. I just couldn't do it. So
you can't be 100%, but I'm sure you were able to decrease it in a lot of ways.
A lot of ways. But you still go to a restaurant or something and you still get the plastic straws, or, there's still so much plastic everywhere. But.
Yeah, it's everywhere. A little good news is that I think our governments and our local governments are getting a little bit aware of that. There's been a little bit, like around here, they're going to eliminate plastic bags, which is good. But even my vegetables come wrapped in plastic. So what do you do?
Yeah, I know. It's crazy.
But we can stop using plastic Tupperwares and single-use plastic cups, and I don't buy plastic utensils. I was actually at a health fair the other day, and they had these like light kind of wooden utensils. They were like between wood and paper. They were totally recycled. I had never seen anything like that. I thought that was really cool. So getting away from the plastic spoons and stuff whenever you can.
Yeah, I don't think people really stop to think about how much that impacts your hormones.
Right. And water bottles. Yeah. Water bottles is such a culprit. Yeah. What it's doing to our environment to have all this, extra plastic is really kind of sad. So I totally recommend, if you can get a house water filter and drink out of either glass or stainless, as much as you can. You can't be 100%, but you can be better. You know, and laundry detergent is a big one. Dryer sheets, the chemicals in dryer sheets. Oh, my daughter has a friend, and he came over the other day, and I almost couldn't breathe. And I was like, I could smell his dryer sheet from his clothes, so strong. Or sometimes my neighbors will be doing laundry, and I can smell it in the air.
Oh, wow. So,
yeah, I don't know if you've ever realized that. Like, once you take that out of your life and your lifestyle, you become more aware and a little bit more sensitive to it, which is, I think it's a good thing, because I think that's a sign that we're cleaning up a little bit.
Yeah.
Yeah. And then the other big root cause of PCOS and most health conditions is our stress system, our stress response, our adrenal glands. That totally, how much we sleep or not, how much we, in our worlds, we don't have a lot of downtime. We just go, 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 go. And that definitely affects our hormones. Yeah. I mean, almost all women can look back to a time when something disruptive happened in their life, and all of a sudden they got their period twice that month. It could happen that quickly, right? That, you go on vacation or something traumatic happens and you get your period again. So hormones, that's a illustration of how quickly hormones react to our stress response.
Yeah, gosh.
So long-term stress, long-term cortisol disruption definitely leads to long-term disruption in hormone balance in the cycles. And then cortisol is related to insulin. So if we're stressed all the time, or our stress response is affected, the way we digest or handle sugar in our body will be affected. So that's, in PCOS, the number one root cause is insulin resistance. Or you can call it a root cause, or you can call it a result, because it's kind of like a feedback loop, right? But 70 to 80% of people, or of women with PCOS, have insulin resistance in it, even if it's only in its early stages.
Interesting.
And so if anybody is listening, I like to make this kind of known, because I never learned to check fasting insulin and glucose at the same time. And there's actually a ratio to check that. And so if somebody has been told, oh, your sugar is fine or your hemoglobin A1C is okay, and they're having trouble with overweight or the metabolism isn't what they expect, or they're having extra sugar cravings, get your doctor to not only look at, or your healthcare provider, to not only look at the fasting glucose, not only the blood sugar, but also the insulin. And if that is off, then maybe further testing is needed.
Mm-hmm.
Of course, my idea is nobody should have processed sugar, and then that's what you do to treat it in its early stages, right?
Mm-hmm.
So if we can't find anybody to do the testing and we're not sure, we can take out sugar and see how we feel. But that's not always easy or fun, right?
It's so interesting because so many of these root causes, well, first of all, first thing I think of is our beautiful standard American diet, right? And what we're doing to our gut. But a lot of these root causes, I can think about hypothyroidism or Hashimoto's, and a lot of them are the same. And
right.
Why do some women get PCOS and someone else might get Hashimoto's? I honestly have no idea, but there's so many different causes to these different diseases. It's just,
I think in general, we all have our own stress point.
Mm-hmm.
I mean, when I talk to women in my practice, everyone has that thing that happens when they get stressed. So that thing that hits them when they're either, going through a time where they're not sleeping, or a stressful time, even if it's good stress, sometimes that's a stress. So some women get migraine headaches.
Mm-hmm.
Some women get irritable bowel syndrome, right?
Yeah.
Or like symptoms, right? Some people, it hits them in their gut right away. Some people get headache. Some people get skin things and get like hives and things.
Mm-hmm.
Some people get sore throat. I know I get a sore throat when I'm run down. So if
Oh,
I don't
you do?
listen up, I get a sore throat.
Yeah.
Yeah. So there's a set place where most people will start having symptoms of their body saying, hello, something's up here. Some women get vaginal yeast infections every time they're run down.
Oh,
right?
interesting.
So everybody's got like their certain weak points. And I think that's the same with chronic disease.
Mm-hmm.
I think that some of us, maybe it's genetic. I don't know, right? But some of us will get Hashimoto's. Some of us will get PCOS, depending on what the genetic, or I don't even know. I don't know. This is just pure conjecture, but it's what I see.
Yeah.
But with Hashimoto's as an autoimmune disease is related to other autoimmune diseases, like especially celiac disease and Hashimoto's are very closely related.
Yeah.
So I think you know that. Because you're definitely know a lot about thyroid, that's for sure, right, Maureen?
Yeah, and I do have Hashimoto's, so I do know a little bit about that. So, but I mean, it's just pretty fascinating. I guess kind of where your weak spot is where you're going to take the hit, that's for sure. But it is so interesting how gut is so related to almost everything. I mean, heart disease, everything. It's just crazy. And God, if we could just clean up our diet.
And you know what's often, what I like to do, I tell women, if the only thing I do is empower you to make the connection between what you're eating and how you feel, like that's why I like running 5-day detoxes, because we do like a basic elimination diet and it's only 5 days. And you say, what could happen in 5 days? But in 5 days, women can get in touch with, wow, I feel this, and I never felt that before, or I don't feel such and such, which I usually do. And I think that that's important because there's such a disconnect. I have in my practice with the breastfeeding moms, there's often a, what do I eat when I'm breastfeeding kind of question, or if baby's having a problem with either gas or digestive problems, it's always, well, what do we do if it's something I'm eating? And you don't know how many times I'll ask mom if she's got any allergies or food intolerances, and she'll tell me that she knows she doesn't do well with dairy, but she ate it all during her pregnancy. because she thought she was supposed to.
Yeah.
So I had someone today who knows she's got a dairy milk protein allergy. She said, I know that since I'm a child. I'm like, well, do you drink milk? Well, no, but I eat cheese. Like, to me, it's like nobody ever told this poor girl that if you have this allergy, you take it out and see what happens.
Yeah.
So I think there's such a disconnect there. So I think our job as women's healthcare professionals is to help women to make the connection and to realize that they have control over what their body does instead of just letting it just happen to them. As I said before, like my husband and I did, we looked around at everybody expecting to get old and sick and fat. We were like, we don't want to do that. We don't, I know you can't stop the clock completely, but I mean, people see us, like we've gone out with friends we haven't seen in years and we look around and we go, wow, they all look so old. And they probably think, we don't look like we did when we were 18, but we feel better and we look better and we definitely have more energy than our friends who are eating standard American diet.
Yeah. Yeah. So with your 5-day detox, do you run them like in a group? Like can somebody go to your website and join up, or how does that work?
Yeah, I do it. So if anybody wants to join my mailing list, I send out emails when I'm going to do it. It's sort of seasonally, but I've started to do it more often because what I found out is that so if I have patients who should have an elimination diet and they need more motivation than me just sending them home with a list of foods to avoid, it helps to be in the group.
Sure.
So I do it every other month. It's been lately. And most of the time it's a small group, but we have a private Facebook group. There's 5 days of recipes. There's a handbook. I'm sending emails every day, and I do it within a platform that's got messages every day. And anybody can join. It's distance, and it's mostly for women, but I've let a couple of men in. But it's basically, I like it when it's all girls because I think it makes us freer in the group.
Sure. Yeah.
But what's wonderful about it is the power of the group and women helping each other in the group.
Yeah.
I've had people, it's day 2 and I'm dying for a glass of wine because we take out wine and coffee too. And, people will give each other encouragement. Oh, I had this when I felt like having that kind of thing. And people post their recipes that they've cooked outside of our recipes or pictures of the recipes that I've given them to cook.
Oh, that's great.
Yeah, it's really fun. I love running groups because I feel the power in that. And, and again, like I said, if we can empower women and make them realize what they can do. And like I had a woman lose 5 pounds. I guess the biggest weight loss was 6 pounds. I had a woman who had broke out around her mouth since she had her last baby. She had acne around her mouth and it was really irritating to her. Gone. Somebody else who had bloating, she said she couldn't remember the last time she wasn't bloated and didn't feel uncomfortable. And in just by day 4, she was feeling amazing.
Isn't that something?
Yeah.
And anybody can really do something for 5 days. I mean, that's not that difficult. Exactly. Yeah.
Yeah. And that's like I do it, 5 days, but then I give a Facebook Live on the last day. And this is like a secret. And where I tell everybody, let's not give this up. Let's keep it going. But what's cool about that is we all fall off the wagon sometimes. So I have a lot of repeaters.
Oh,
so
cool.
You can come in once and get the recipes and do it for those 5 days. And then a couple of months later, if you feel like you've been slipping and you need some motivation, redo it. And I give it's like half price if you want to redo it. And it's cheap anyway. It's not a high. I'm not getting rich from doing it, but it's a great way of motivating women and helping women who are already in my practice to stay focused and bringing women into the realm of functional medicine and integrative medicine, because often this is the first introduction they've had to how food can act as medicine in their lives, or the opposite, would be inflammatory for them.
And I'm assuming the recipes kind of change with the seasons. Is that right?
Absolutely. Yep.
Yeah, that's wonderful. So I'll make sure that I include the link so people can find that on your website. So that's
Yeah. If they sign up for my emails, I send out invitations when I'm doing the detox. And there's also, I believe you have the link for my PCOS quiz to find out which root cause and things to do to change. There's a few hints of how to work on the root causes, which is helpful.
Great. So as far as your practice, if somebody was listening, and I know you live in the East Coast, so if somebody was listening in California and they wanted to work with you, do you ever work virtually with patients? Or
I do. I do.
Good.
I always love to have someone in my office, at least for the first visit, because there's something special about meeting face to face. But it's wonderful what we can do on, I have a program that I can actually do a HIPAA compliant, it's like a Skype meeting, but it's HIPAA compliant with video. So we can do that. The only limitation with that is, licensing. I'm a licensed provider as a midwife, and I can prescribe and run blood work in New York, which depending on what state you're in, that might not be. So I could tell you, we could work through that. That's the only limitation. I'm more of a health coaching type, even though I'm a licensed provider. If it's out of state, I have to act more in that capacity. But I love working remotely. I've had people, I think the furthest one, I had a woman from Dubai.
Oh, wow.
Yeah. And I thought that was so cool because I'm like, here I am in New York and she's in Dubai and we're communicating.
Yeah.
So technology is amazing.
It is amazing. And how many people can you touch now? That's incredible, Lisa.
Yeah. I love it.
So I have one final question for you, because I don't want to take up too much of your time, because I know you're super busy. But if you could give yourself some advice, your younger self some advice, what would you go back in time and tell yourself, knowing what you know now?
Well, I could be as simple as saying, don't eat cheese. No. No. I think and this is what I tell younger women, but it's really hard. It's really hard as you get older to give wisdom to young women. But I think I would just like my younger self to know that there was no limits or boxes into which I had to stay. Mm-hmm. I think that I was raised in a limiting background. This is what a woman does. Mm-hmm. You become a nurse kind of thing. You don't expect to be more, and you work within the system. Mm-hmm. I think I have, as I've grown up, become a more mature woman. I'm feeling limitless, and I wish I had that empowerment when I was younger.
Yeah, gosh.
And that's what I would say to younger Lisa. But everything has happened exactly as it was supposed to. Mm-hmm. And I believe that, I really believe that the journey that I've gone through to be where I am now really has made me the person I am now. And that's why I can relate to so many women because of all that I've been through on my journey.
Mm-hmm. So just a quick sidebar. I'm just curious, since I know I interviewed you for my book on thyroid disorder, but I'm just curious how you're doing with your thyroid. A little update.
Yeah. So my thyroid right now, I actually have to get blood work. I've been avoiding having any form of blood work, and this may not be the best thing for your audience to hear, but it's my own experience. Trying to regulate my medication based on how I'm feeling.
Oh.
So I'm really going by my symptoms, and I'm almost ready to have it tested to see if I am where I think I am. Okay. Because I'm feeling good. I have less brain fog. I'm getting more accomplished. Mm-hmm. I'm sleeping well. My only problem is my weight, but that's another issue. But as we get older, things shift. Yep. So
they do.
That's another story. But I don't have Hashimoto's, which makes it a little bit more challenging. I just have low thyroid without mm-hmm. Hashimoto's. Mm-hmm. So I know all the tricks to get rid of antibodies, but that's not my personal condition. Mm-hmm. So it's a little bit more challenging. But I'm feeling good. I'm definitely feeling good. And I know how I feel. We just had the holidays. You mentioned Lent. I had Easter, and I had all the usual stuff that I don't eat.
Yep.
Even though we had the gluten-free cupcakes, my brother brought over a cannoli cake. There and what the heck, right? And for a couple of days after that, I didn't feel good. So again, you make the connection. I enjoyed it. I don't give it any value as far as good, bad, or that kind of thing. But just it was what it was. I enjoyed it, and now I have to get back on track. So I think that's how I live. And, a balanced life, I think, is important, not to make it something that makes you feel guilty or that you're not, so many women come in and say, I was bad this week. I'm like, you weren't bad. You enjoyed the cake.
I know. Why do we have to feel guilty about everything? Let's just do that to ourselves all the time.
Yeah. But thanks for asking about my thyroid.
Yeah, I was just curious, and I think it's fascinating that you kind of gauge it yourself, and you'll have to give us an update because most people just take whatever dosage the doctor tells them and hope for the best instead of really paying attention to yourself.
That's part of my coming out of my box. I don't say anybody anymore.
Yeah, that's
I don't know
awesome.
if that's good or not. But no, I think it's so important for us to realize how we feel is it. If we feel good, if we feel that we're in a situation in our health that we can function well, and we feel, we're happy, then that's what matters, right? More than the numbers on the lab tests.
Yeah, absolutely.
So that's where I am.
Well, thank you so much. This has been fascinating, and I can't wait for everybody to get your information so they can go on your website and join your detox and everything else. So thank you so much, Lisa.
Thank you so much, Maureen. It was such a great time talking to you and being a part. I'm honored because I was seeing some of your guests. I'm looking back some of the people you've interviewed, so many interesting women, and I am honored to be in the lineup with them. Thank you so much for including me.
Oh, thank you. Thank you so much.
Hey, thank you for joining us today. I hope you enjoyed this episode as much as I did. If you can, take a moment and give us a review, and please join the VIP room in Facebook for more discussion and insights. You can find us at Graceful Healing Podcast VIP room. See you there, and see you next time.